Getting ready for retirement can be tough, especially when it comes to getting a grasp on your health care options. Michael Egan is a certified financial planner and partner at Egan, Berger & Weiner, and he's here today to give us tips on understanding Medicare. Welcome back. Thanks for making all of these things so easy to understand. So let's jump right into it. What is Medicare? We always hear about it, but what is it really?
Yeah, a lot of people are confused. Medicare, Medicaid, what's the difference? Today we're going to be talking about Medicare, which is basically the primary health insurance program for people in the United States over age 65. President Johnson actually signed it into office back in 1965, just coincidentally it matches the age. But it's really your health coverage from age 65 on for most people.
And there are several parts to this coverage, correct?
There is, yeah. So the government-run parts are Part A and Part B.
Okay.
So Part A covers the hospital bills, and Part B covers the doctor bills. So really, to be fully covered, you need both in most cases. There's also additional parts that private insurance companies work with, Medicare Advantage, prescription drug plans, also known as Part D, and then there is the Medigap scenario that we'll talk about a little bit later.
Okay, so we talked about you have to be 65.
Yes.
To get into Medicare. But what about individual enrollment? Are there certain times that people have to look out for signing up? Is this something that people should be building into their retirement plans?
Absolutely. And I've seen mistakes made on this all the time within our practice. We try and be proactive, but occasionally things still happen. So your primary enrollment period, the one you really don't want to miss, surrounds the month you actually turn 65.
Okay.
So it's the 3 months before, the 3 months after, and including the month you turn 65. So really it's a 7-month window. And to be covered the whole time so you don't have a gap in coverage, which most people are afraid of that.
Right.
Typically you'd like to enroll the 3 months before you turn 65, so the coverage goes into effect the month you turn 65.
So as you start planning that birthday party for your 65th birthday,
yes,
also start planning.
Yeah, sign up for Medicare before the party so you can enjoy the party.
Okay, sounds good.
In case you have a little accident at the party and you need to get some health care.
Good plan. So we were talking a little bit about that gap. People don't want to have a gap, but is this the only kind of medical coverage that people need? Once you sign up for Medicare, you're set?
No, you need those additional parts. So those private insurance parts that I talked about. So Part A and B, again, the hospital bills and the doctor bills. But what about prescription drugs? Well, that's where Part D comes in. So if you don't have a prescription drug plan that's covering you in retirement, like maybe you had a corporate retirement plan that was helping you with health insurance costs through retirement, then you're going to need to pick up Part D. And the additional stuff that you might need beyond that would also be Medicare Advantage. Some people choose to get a Medicare Advantage plan instead of Part A, B, and D.
So that's the one-time thing.
Yeah, that could kind of cover everything.
Okay.
But you got to look and see if that's the right plan for you. And even with Part A, B, and D, you may also need a Medigap policy, also known as a Medicare supplement.
Okay, so that these are things that I hadn't even thought about, because you hear like sign up for Medicare, and you think that's sort of your magic pill, if you will, to stay on the message. But you really need all these parts to sign up, and that gives you the full coverage then? So if I have A through D and everything in between, then I'm covered?
Well, almost. Okay. So it's not, let's say, the typical health coverage that people think about. Yeah, so hospital bills, doctor bills, prescription drugs, and most of that gap that isn't paid for by D, A, or B could be picked up with a Medigap or Medicare supplement if you buy the right plan.
Okay.
Or a Medicare Advantage plan. On top of that, though, there's going to be additional costs that you didn't think about. Ooh. Things like long-term care typically are not covered at all by any faction of Medicare.
Okay.
Medicaid, which again, you got to be financially indigent to qualify for that, helps pay for that, but not Medicare. So long-term care is a big gap. A lot of people haven't planned for. Dental coverage, vision coverage, in a lot of these plans. Some Medicare Advantage plans cover it, but in a lot of these plans, you're going to have to look at additional coverage for dental and vision, which can also be big healthcare expenses.
When and how do we enroll for Medicare? What's the process that we should look to do? And should we just come to our financial planner like Egan, Berger, Weiner and say, you guys just take care of it for me, here are my needs?
Sure. So here's the easy part. If you're already getting Social Security, when you turn 65, you're going to automatically be enrolled in Part A and B.
Okay.
So there's really nothing you need to do at that point. I would, of course, check on it, because occasionally things slip
Make sure
through
your
the cracks.
address is right and all that kind of information. Okay.
But, if you're looking at it and you're basically saying, what do I need to do? The easiest thing to do is just basically go to ssa.gov.
Okay.
And there's actually a button that says apply for Medicare right there. They couldn't make it any easier for you. Now, if you're not really computer savvy and you think that's a little bit too much, then there's also an 800 number, and we actually have it up here on the screen.
Great.
For the viewers.
So it really is easy, and it's something that we should have our family members who are in that 65-year-old age bracket and getting close to it start looking at? And again, should we be working with a financial planner? And
I think so. I mean, ultimately, you should have a financial plan that factors in healthcare costs.
Okay.
For the typical retiree in the United States, even with all those parts that I talked about, their annual healthcare expenses exceed $5,000 per person.
Wow.
Between the premiums for the Medicare parts and out-of-pocket costs that typically go on. By the time you hit your 80s, that number could easily double to $10,000 a year. So as a couple in your 80s, it could easily be $20,000 a year of out-of-pocket costs that maybe you didn't plan for in your financial plan. So working with a planner or an advisor who can kind of educate you on, we need a little more cushion in the plan to help pay for these costs so we don't run out of money before we run out of life, might be the best thing to do.
And people are living longer these days, so it's something that we really need to think about when we're making these long-term plans, right?
They definitely are.
Anything that you would suggest that people look at now? Let's say that I'm 64 years old. Anything that you suggest, like this is your first step, go to ssa.gov probably is the first step.
Actually my first step would be to talk to my current health plan benefits administrator and see what they require for me at given dates. So again, if you're still actively working, you're working for a company that has more than 20 employees, a lot of people don't need to sign up for Part B or these other parts because they have existing coverage. But it's something you got to check out in advance.
Okay, so we've covered Medicare. So will you guys come back and explain Medicaid to us next time?
Absolutely.
Okay, we'll put that on the books and we can look forward to that. If you're turning 65 though, now's the time to get on it. Start planning that party and start planning your long-term insurance plans. I'm Sonia Gavankar. More Let's Talk Live is coming up. Stick with us right here.